Good morning, everyone. This is Francesca Martinez. With the American Heart Association. I want to welcome you this morning to the Empowered and Well Faith Town Hall. And just a quick couple of logistics before we get started and our speakers begin. First of all, your phones, please mute your phones and your microphones. Also, we should only see the video of our presenters at this time, but feel free to show us your faces. Also, let's roll call in the chat box. Let us know who you are. Put your name and organization in the chat box. We want to say hello and welcome to you. Also, a quick reminder that this call is being recorded. And if you have any questions, you can, of course, put them in the chat box or email to empoweredtoserve@heart.org. So again, thank you so much for joining us this morning. It's going to be an exciting time, an informative time, and a time for us all to come together. So without further ado, I'm going to hand it over to Pamela Garman-Johnson.
Well, good morning and welcome, welcome, welcome. We are so pleased that each of you all could join us this morning to discuss our faith and health. And so this is a wonderful opportunity to hear from thought leaders as we are staying in place. And so with that, I will share that I am the National Vice President of Health Equity Impact and National Partnerships for the American Heart Association. Dr. Sanchez?
Good morning, everybody. Sorry, my voice is a little out of practice. I just got up a little while ago. And for the occasion, I dressed up. I think most of us these days are wearing t-shirts or pretty casual clothes. And the fact that you can actually button the top button, I'm dressed up today. I'm so pleased to be here. And let me pass this back. We got Pastor Sonjia Dickerson on. I'd like her to get introduced and then we'll get going.
I am Pastor Sonjia Dickerson, and I serve at the Dayspring Family Church in Irving, Texas, and I am super excited to be a part of this town hall, and we've got some great people who really have a heart for the community and a heart for people, and I'm happy to be here. And so I'd like to share some things with you. The first thing I want to say is that every season must come to an end. That is the way God established things. And there is a time for everything and a season for every activity under the heavens, is what it says in Ecclesiastes 3:1. And so during this challenging season, this difficult season, it's important that we gain strength and that we learn to persevere. You know, just despairing about it and complaining about it will only make you feel worse. And so the best way for us to deal with a difficult season is to ask ourselves, what can we learn from this season? And it's not easy to do that when you're hurting. It is difficult to do, but it is definitely a more positive way to approach the matters that we are facing, and it will guarantee you success even in a tough time. And so that is arming ourselves with information and making sure that we are very aware of what's going on and ways that we can work together during this difficult time. You know, what you learn in difficult times can really work well for you later. It becomes your testimony. And what do testimonies do? Testimonies help others. They not only build our faith personally, but they also serve as a witness to God's power to bring us through troubled times and through difficult times. The truth is, God promises to deliver his people. In the 34th Psalm, it says, the righteous person may have troubles, but the Lord delivers them from all of them. And so when we look at seasons, sometimes we prefer the spring or we prefer the summer. People tend to love the spring and they tend to love the summer because of the warm sun and the colorful views that are in nature. But the truth is, there's just as much beauty in fall and in winter as there is in summer. You just have to look in different places than you do in the spring and in those warmer climates. So it may not be time for the season to change. It may just be time for us to find something beautiful in the season that we're already in. We just have to look in a different place, And so we don't look directly at the difficulties other than for informational purposes and for us to work together to get through the season. But we look inside of ourselves for strength and for character and for perseverance and for patience and for faith. And that is what we're developing in this season. And all of those things are beautiful. They're beautiful. So doing this will help us get through a difficult season. And we remember that in Romans 8:28, it says, and we know that God causes all things to work together for good to those who love the Lord, to those who are called according to his purpose. And so there are some great things that we are going to gain in this season, and we have the opportunity to work together to successfully get through it. So I want you to feel better. I want you to feel better. And so I've got 4 steps for you to feel better. Are you ready? Are you ready? Here we go. Well, first of all, we pray. And so the first thing we can do is just saying a simple prayer. And we can be very, 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 very transparent with how we're feeling in that moment. And so you don't have to know some special prayer. You can just pray exactly what you're feeling. Secondly, to feel better, I want you to breathe. So everyone take a deep breath. Are you ready? Breathe in and hold it for a moment and then exhale. I just want you to breathe during this season. It helps you feel better to inhale deeply. You know, there's another scripture in Job, the 27th chapter, and the 3rd verse. It says, for as long as life is in me, the breath of God is in my nostrils. Breathing is therapeutic. It relaxes you. It helps you feel better. Okay, the third thing I want you to do to feel better. Are you ready for this? I want you to dance. Okay, now I'm not the best dancer. I'm not, but I do know how to move, okay? And I want you to get moving. You know, you can feel better by taking a walk. If that's an option for you. If not, it certainly is an option to get up and move around. How about jumping rope? Oh my goodness, it's been a minute since I jumped a rope, but I can do, at least I can do single, maybe not double dutch, but I can do single. Or we can dance, like David danced. David danced in the Bible, and they said he danced so that he began to lose his garments. And he was just so excited. It says that David danced before the Lord with all his might. You will feel better if you dance. So I can't see all of you, but will you just do a little sway for me? Oh, Pamela's got it. Eduardo's got it. I see you, Francesca. Yes. It's our opportunity to breathe and to dance and to pray and to look for those things in this season that are beautiful, because there certainly are some. Then lastly, I want you to refocus. Not just a steady diet of negativity, but refocusing on the fact that we don't have to fear. It says, fear not, for I am with you. Be not dismayed. This was God talking in Isaiah 41:10. Be not dismayed, for I am your God. I will strengthen you. I will help you. I will uphold you with my righteous hand. And so refocus on what you can do to help others. Refocus on implementing the guidelines that have been shared with us. They are on cdc.gov, and Eduardo's going to talk to us about some wonderful ways that we can make sure that we protect ourselves and take care of ourselves. Refocus on blessing those who are in need when you can help. Refocus on meditating on scripture and building up your faith and growing your relationship with God. We focus on implementing the things that we've been told to implement. Oh my gosh, I've got my hand sanitizer here. I have my antibacterial hand soap. I have my mask. I've been washing my hands. My hands are so clean. Oh my goodness. I have a whole new regimen. I sing while I wash. I sing happy birthday twice. And sometimes I make it my birthday 3 times and just keep singing while I'm washing my hands. The beautiful things that we're learning. I'm disinfecting all of the places that we touch frequently. I have become so close to Lysol and Pine Sol and other great cleaners. It is an opportunity for us to look for the beauty in the winter that we're going through right now. So I just want you to breathe, and I want you to feel better, and I want you to feel better now, and I want you to know that this too shall pass. But it's going to pass much easier if we work together and we implement all of the things that we have the opportunity to implement in this season. You know, you don't do the same kind of gardening in winter that you do in the spring and in the summer. And so we've got some new gardening that we need to do now. And if we all work together, our neighborhood, our community, our country, our world will be a better place. Happy to share that with you.
Well, thank you, Pastor Sonjia. So appreciate those words of wisdom. And I love the 4 steps. First of all, to pray, to breathe, to dance, and to refocus. And I know for me personally, this time period has definitely allowed for not only myself to refocus, but for my family, and really prioritizing what's most important so that we are able to do all of the other 3 areas that you mentioned. So thank you very much. So on behalf of the American Heart Association, we hope that you and your families are doing well. This is unprecedented times for us as a country. But through that, we will navigate and we will persevere for sure. And so the coronavirus, as we know it, is not discriminating at all, regardless of age, religion, ethnicity, where you live. It does not discriminate. And so with that, we want to ensure you that the American Heart Association is truly committed to providing credible information to you. And that is the reason why we are hosting these town halls, so that you can hear from thought leaders in this area and understand where the American Heart, and understanding that the American Heart Association is here for you. And so with that, I want to do 2 things, and I want to reiterate what Francesca mentioned, and that is we want to make this a dialogue. So if you have any questions, please put them in the chat box. We are monitoring those, and because we do want to make this extremely interactive. And so with that, we have the ability of hearing from Dr. Sanchez and from Pastor Sonjia. And so I want to make sure that you are able to take advantage. And so now more than ever, places of worship are truly being called upon during this time period. And we recognize that new infrastructures are having to be adjusted in order to accommodate so many requests. But it is really great to see how we are all navigating through this process so that we can provide the necessary tools and resources that you are needing and wanting during this time period. Our mission as the American Heart Association is to be a relentless force for a world of longer, healthier lives. That is really big and bold. And I say that because in order to do that, we have to work with others and truly be partners. And so that's why we are here today. You asked for this. You asked for us to provide you the opportunity to hear from others, and you wanted to hear from the American Heart Association. And that makes us feel good as a partner to know that you're looking to us for guidance. And then, so our top priority is how do we ensure that every individual and every community everywhere has the necessary resources and information for them to be able to navigate during this pandemic. And so we are continuing to do our work in communities and working alongside others. We are listening to what you are saying and incorporating that into our strategies at the American Heart Association. We've been working for some 24 hours a day just to ensure that we are delivering on being a trusted voice in the community. And so one of our at this time, I would like to turn it over to Dr. Sanchez so that he can provide an update on COVID-19. And please remember to put any questions in the chat box, and then I will be able to address those accordingly. Thank you. Dr. Sanchez?
Good morning, everybody. I was caught a little bit by surprise earlier. You heard it in my voice. But just for information, I serve as the Chief Medical Officer for Prevention at the American Heart Association. I work closely with Pamela, Francesca, Katie, and others every day. I've also been given the opportunity to serve as not the czar, but the impresario of COVID-19. Czar is not culturally appropriate. My name is Eduardo Sanchez. It's not Eduardo Sancheski or a Russian name, and I don't mean any disrespect. I just trying to keep it culturally appropriate. I served as the health officer. I ran the state's health department in Texas from 2001 to 2006. During that time, I oversaw the response to SARS. There was a little bit of activity in Texas. I oversaw the response to a shortage of flu vaccine in 2004. And I was the commissioner of health during the time that 500,000 Louisianans came to visit Texas Labor Day weekend 2005 because of a little pesky hurricane called Katrina. So I've got a little bit of responding to public health emergency under my belt, and I've been called upon and am proud to be the voice, among others, about COVID-19 at the American Heart Association. One more thing, Pastor Sonjia is a tough act to follow. And I think Pastor Sonjia might ought to be Master Sonjia, Masters of Public Health, because she got some things said right that now I don't need to say, or maybe I'll just repeat them. I do want to say one thing. This is a tough time, and I appreciate and I think words of hope are critically important. But the truth is that some of us have had loved ones who've either been infected and have experienced COVID-19, which is what the disease is called. And some of y'all know somebody or have somebody in your family who might have passed away, might have died because of COVID-19. And so let me just start with words of condolence. And one of the things that we can do is to play that being a shoulder that someone can cry on, offering our thoughts and prayers to those who are going through tough times. And I've already experienced what it's like to do that for someone else, and just hear back how appreciative people are that even in this time where we can't be together and hug and do the things that we are used to doing when we are consoling others, that calling up, reaching out is critically important. One of my favorite quotes, and I learned early on in life that having a favorite quote makes you seem a whole lot smarter than you really are, but I latched onto one, and it's been my favorite quote since I got out of high school: "Chance favors the prepared mind." It's a Louis Pasteur quote. And it's just the reminder that there are times, and the American Heart Association is benefiting from having put things in place that now can be put to use when it wasn't necessarily for COVID-19. And we'll get to that in a little while. Our Empowered to Serve wellness opportunity, and Pastor Sonjia will be talking a little bit more about that. The AHA is working diligently to provide reliable science-based information for all people in the United States, but particularly the 120 million people in the United States who currently have one or more cardiovascular conditions, might be persons who are suffering or have suffered a stroke, and are already at very high risk of COVID-19 complications. So one of the things that we've learned, both from what we've seen in China and now what we're seeing in the United States, is that, yeah, COVID-19 is a pretty nasty deal. but it's a worse condition, and it can have much worse outcomes, including a higher likelihood of death if you are somebody with an underlying medical condition. In China, they very well describe that persons with cardiovascular disease, persons who had hypertension, and people with diabetes were at higher risk of having a bad outcome, again, including death, up to 3 to 4 times higher rates of death among people with those underlying conditions than folks who did not have those underlying conditions. And it turns out now, as we've been watching the first report that I've seen about what's going on in the United States says, if you are somebody with underlying cardiovascular disease or diabetes, the likelihood that you will be hospitalized with COVID-19 is higher than if you don't have those things. And the likelihood that you will end up in an intensive care unit is higher than if you don't have those things. And the message there is everything that Pastor Sonjia said about washing your hands and cleaning your space and covering your mouth. Social distancing, I will add, I'm not sure that she included that one, but it's a really, really important one. And if you have any of those underlying conditions, you have to be ultra careful. As I've been saying, you should act not only as if you have COVID-19 when you're out and about, but you should act as if every single person you come in contact with, including anyone who left your house and comes back, that they have COVID-19. And if you do what I'm doing at my house, you cannot walk into my house without walking directly to a sink and washing your hands with soap and water. We're going to talk a little bit later about which is better, soap and water or hand sanitizer. And that probably has you at the edge of your seat. You just can't wait to hear the answer. So this is going to keep you listening. Interesting and apropos to today, in the Dallas Morning News today was a op-ed, and I'm looking at something, so I'm not going to be looking at the camera, written by the Reverend Frederick D. Haynes, senior pastor of the Friendship West Baptist Church in Dallas. So very, very relevant. And that op-ed is titled, African Americans Face a Higher Coronavirus Risk. And I would add, for purposes of just sort of being as inclusive as possible, African Americans, Latinos, and American Indian Alaska Natives face a higher coronavirus risk. Quote, I pray for our world community. So one of the things that he does from the very beginning is say, this is a global issue, and then he narrows in and begins to express some observations about what's going on in Dallas. Actually, the op-ed is about the really good job that's being done in Dallas, and hopefully all of y'all who are on the call live in communities that are ahead of this curve and not behind the curve. I know there's a difference, but we are fortunate to have had some folks who were paying attention and not necessarily taking all their cues from the federal government's word, but we're watching what was actually going on in the world, and I'm hoping some of y'all live in those kind of communities as well. But here's some critical quotes that were things I was going to talk about anyway, but they come from the word of another pastor, and so Reverend, let me share these. Quote, racism and economic bias infect our medical systems, adding insult and inequity to injury. I love that. I love that sentence because A, it's got that alliteration that is the kind of thing that captures our ear. Racism and economic bias infect our medical systems, adding insult and inequity to injury. Next quote. There is, quote, concern in our most vulnerable communities that those already suffering the most as infection rates rise and death tolls mount. In other words, those who are most vulnerable, I already said it a minute ago, if you've got underlying high blood pressure, and as y'all know on this call, African Americans have the highest rate, not only highest rate of hypertension, but also the highest rate of uncontrolled hypertension. And I can't help but believe, and I'm beginning to see the evidence that says the degree to which your blood pressure is controlled is the degree to which you may do better than if it's not controlled. And I don't think anyone would be surprised by that. The same goes with diabetes, and the same goes with just underlying cardiovascular disease. So one of the messages that I was going to get to later that I'm just going to say right now, if you have a medical condition, get right with your medicines. Be taking those medicines the way they've been prescribed. That is critically important, along with the hand washing, face masking, washing surfaces, social distancing. Now add to that taking your medications. Very, very, very important. And those are the kind of messages that we need to be sharing with our loved ones. So if you've got a loved one in your family, my mother-in-law lives a mile and a half away by herself. She's been sequestered for 3 weeks. I look for her email when I get up in the morning. Eduardo, I'm doing well. How are you? What I do is I deliver to her. We've made it clear that even who delivers should be limited in her case. She's an 80-year-old. So a couple of other things that I think are critical to share with you. I talked about the underlying medical conditions putting people at risk. If you're in your 70s and if you are in your 80s, be very, very, very careful. And if someone in your life is in their 70s and 80s, protect them like they are gold in Fort Knox. They need to be protected from the things that might hurt them. I've got some information here I've written myself so many notes, but they are organized. I've written myself a note about the experience in Europe, which is that in Europe, and my head is turning because I'm looking to see if I got it somewhere else, but the experience in Europe is that more than half of people who have died in Europe are over 80 years old. And among the people who are most sick and going on into intensive care units, they're 65 and older. So let's go back. African Americans more likely to have high blood pressure than most any other group. When it comes to diabetes, the rates of diabetes are very high among African Americans, Latinos, American Indian, Alaska Natives. So in that category of people with diabetes, there's going to be a disproportionality as it relates to outcomes if people end up in the hospital and end up in intensive care units. But that disproportionality doesn't quite end there. The kinds of jobs that Latinos, African American, and American Indian, Alaska Natives have are the kind of jobs that are ones where people right now have either been furloughed, aren't able to go to work, may not be receiving a paycheck, and while they're waiting for the checks to come in the mail from the federal government, they are in a world of hurt. And even those who are able to work right now are working in essential services, which may include coming into contact with lots and lots of people. So if you are one of those folks, or you know folks who are having to get out and about and work, the most important things you can do for them is get them some soap and water to have in their cars. Make sure that now they are indeed using masks. And I'm going to talk about what masks are for. They're not so much to protect you as much as they are to protect others, but we can talk about that later. And that they have every opportunity to be socially distant, and that they express concern when they are when they find themselves in places where that social distancing is not possible. We need to advocate for and try to protect all people who we love. I've meandered a little bit. I think yes, ma'am.
May I just interject a question quickly?
Absolutely.
So one of the questions that's come up, and you touched on it a little bit, that has to do with eating food from restaurants or picking it up. What advice would you give about, safety measures if you do have to eat out and
That's
pick
a
up
great
food?
question. So I don't think we're eating out. I think we're having food brought
Yes.
up, right? No, I know what you're saying. So
Yeah.
I think that's a really, really great question. And I'll just describe what happened yesterday. My daughter, so you may be living in communities where, this is a really interesting time. All kinds of things have been disrupted, up to and including the delivery of food to restaurants. So we saw a posting that one of the big suppliers to restaurants is now boxing food packages. And for $45 cash, we got this gigantic box of produce, some grains, some eggs, some bread, way more than one could get in a supermarket. Two things, there's a few things about that. One, it's a way to support the supply chain that needs to continue having a place to deliver food. We don't want the workers who are producing that food not to have a job because no one's buying on the other end. The other, in some regards, is that it keeps you out of the supermarket and out of that harm's way. So my daughter was in a line in a car. She pulled up, somebody put a box into her car. And what we do in our house with all packages that come from the outside and anything that's been delivered, we have ordered food from restaurants. We're trying to support restaurants in our community that are doing that. So I'm getting to the answer, Pamela, is bring it into your house, put it on a counter, be very aware of where you're putting it. As you remove things from the box or the bag, if it's in a container, already in a container, let's say you buy food, I say transfer that to a container that you know is clean, throw away the container that the food was in, and if it's food that you're buying that you're going to put away, you should wash every single thing that comes into your house, whether it's in a box, whether it's in a bag, whether it's a piece of fruit. If it's produce in a bag, transfer it to another bag. That way, clean it off and then transfer it to another bag. If it's something like we got some rice and we transferred that rice into a container that was our container, didn't try washing the rice. That's a little bit too much. One can do that a little bit later. And then once you've done that with everything, and I mean everything, we're washing the outside of bread bags and everything. And you can say to yourself, that's really over the top. And I would say to you, over the top is what we have to do because it's the only thing we can do. There's no medicine. There's no vaccine. The only people who can protect us are us. We can protect ourselves and we can protect those around us. So when that package comes in, unpack, wash everything, discard everything. If it can be recycled, put it there. If it needs to be thrown in the trash, throw it there. Wash your hands, clean the surface, wash your hands. And if you wanted to insert a washing your hands anywhere in that step, if you've got a lot of stuff and you feel like, let me go wash my hands, go wash your hands. You can never wash your hands too much in this COVID-19 environment. So I hope that helped. And again, the key things are treat every single thing that you don't have direct control of as if it could have coronavirus on top of it.
Oh, Dr. Sanchez, thank you so much. You taught me quite a bit just then that I need to incorporate a few steps in when we're bringing things into our home. So thank you for that. The other question, which I think many of those on the call would benefit from, is because many of the faith institutions are distributing food to others, what safety measures should they put in place? I mean, I know a lot of what you just stated applies here, but think about they're getting food in and then they're having to distribute it back out. What should that look like for them?
So I think that anything that we do that puts us into a third environment where there's going to be people doing things, we want to make sure that those individuals can be maximally protected. So there should be at the church, if that's the place where the distribution is going on, when the stuff is received, people should be wearing gloves if they're managing a lot of stuff that you can't hand wash every single bit of. There should be hand washing stations throughout, or hand sanitizer. And I'm probably giving away the answer to which is better, soap water or hand sanitizer, but that's okay. All the bathrooms in the church facilities should be well stocked with soap and paper towels. We can all think about how in the last can't say 2 weeks because we haven't been out, but there's those times where we're in the bathroom and we say, holy moly, no soap, or holy moly, no towels. Not a time where that's okay. And we need to, our church leadership needs to make sure that that is present for folks. The extent to which there can be gloves, critically important. And I believe that now that we are going to move to masks, we should expect that people who are doing this work are wearing masks. Now let me stop there for a second, and I've made a mask. I made a mask last night. Here's my mask. And what you will see is that the CDC yesterday has said, it's really, I've got the language here. Everyone should wear a cloth face cover when they have to go out in public. Now, here's the critical thing. Those face masks are not to protect you. The face cover is to protect others in case you are infected but have no symptoms. And while most of us are chilling at home and aren't exposed to anybody, so how could we have it? If you are volunteering to distribute food, there is a chance that you will come into contact with somebody or something that is, I don't like the word contaminated, but has coronavirus on it. And so you should act as if you have it, and wearing a mask is letting people know that you are protecting them from you. And I believe that soon wearing masks in the United States when people are outside is going to be the thing you expect people to do. So, word to the wise, wear a mask. I show you this because I made this. This is a handkerchief. It's actually monogrammed on the bottom. That says Eduardo Sanchez. I didn't buy those. My dad died 4 years ago. Those are one thing that I inherited. I never thought I'd use handkerchiefs. I'm not a handkerchief kind of guy. But I found a shoestring and I sewed it on the two ends. Yeah, I sewed it myself. I sewed it in the middle. Here's a mask. There is a mask pattern, at least one, that you can find at the New York Times website. So I think that if you search New York Times face mask, it'll come up. And I say that because my 85-year-old mother, who's been telling me how bored she is, she has a little bicycle thing that she does in her chair, and she's not going outside, and she's like now starting to order puzzles because she's done all the puzzles that are in her house. I called her up 2 days ago and said, maybe you can make a mask. And she made a mask. And she posted her picture on Facebook of making the mask. And now she's getting friends of hers from the Dominican Republic, which is where my mother is from. She lives in Florida, actually. And friends and family in the United States who are seeking guidance on how to make a mask. So I know that some of y'all who are on this call, on this webinar, know how to sew, or you know someone who knows how to sew. And there may be a little cottage industry there of making face masks. And actually, this one's not terribly creative, except it's monogrammed. But pick your own pattern and be individual. Because this just looks like, who's that? Whereas one can be creative and make it work. Now, I say that I'm combining seriousness and a little bit of humor, because I do think one of the things that I would add to the fore is find some humor. So breathe and find some humor in what's going on, because there is a little bit of humor, and that's be positive / be humorous. So Pamela, I'll stop there. That was a lot. I filled that with lots of extra stuff.
Oh, no, that was very helpful. And it's actually feeding into all the questions that we're getting. So we're getting a lot of questions, which is great. One of the questions that came up was, does putting food in the refrigerator kill the coronavirus?
So I would err on the side of, I don't know, act as if it doesn't and just clean it off. Like that's just, I would say, why take a chance? I have no idea. I just have no idea. And rather than, one more thing, so rather than think that that's the case and take comfort in that, and then relax on all the other things that we've talked about, I'd rather just say, act as if every single thing you have come into your house from somewhere else in some way or other has coronavirus on it. One thing to make clear, these masks are just meant to be an ad. They're not meant to be a substitute for anything else. You still need to wash your hands. You still need to keep your hands away from your face. Now, there was some comment about how do you keep your hands away from your face when you're putting on a mask? Well, I just did, so I don't think that's impossible. Some other masks you might have to. Wash your hands after you put a mask on your face. Wash your hands after you take the mask off. Just wash your hands anytime it could have been close to your face. So wash your hands. Keep your hands away from your face. I'm looking outside because now it's raining and I heard it. Make sure the surfaces around you are clean and maintain social distancing. This does not mean that you can get 1 foot away from people. This just means if you happen to breathe hard, it won't linger in the air and make someone else get sick. Okay, sorry.
Eduardo, thank you for that. No. One other thing, so dental services. So, many of those, they have been suspended. Dental services have been suspended. And so can you talk about dental health and heart health? And what should we be communicating to communities about dental health and heart health?
So dental health and heart health are interrelated. I would say to you, if you're not brushing your teeth every day, at least once, now's a good time to start. And the degree to which you can floss and add that to your normal daily habit, do that. And understand that delaying a teeth cleaning is not the same as delaying an appointment with your doctor to follow up on diabetes and hypertension. Not to say that dental health is not important, but in the scheme of things, diabetes and hypertension are critically important. In that vein, and I'm going to stop for a second because I want to make sure we get it back to Pastor Sonjia. So last thing, it is really important that you keep taking your medications. If you have high blood pressure, diabetes, frankly, any condition you have, take your medication. The other things are to do those things that are going to protect your heart health. I cannot help but believe that if you're not smoking or you can quit smoking, you're going to be better off than if you are smoking. I just cannot believe that it can be any different. And actually, there's beginning to be some evidence that says it may be the case that smokers compromise their lungs enough that they may be a setup for a worse outcome if they get COVID-19. And it may be the case that even vaping is causing some damage to the lungs. And I'm going to be really careful to just say it may be the case. But I would say vaping and COVID-19, probably not a good combination. Eat healthy. The fact that these questions are coming means that people want to figure out how to get healthy food into their homes. And to the degree that you can buy fresh produce, keep buying fresh produce for 2 reasons. 1, it's good for you. And 2, we want to maintain that supply chain and keep people working who can be working and making a living even while they supply us food. 3, be active. I think the thing about moving, dancing, my favorite dance is a merengue. That's a Dominican style of dancing, but whatever it is, do it. And I'll go a step further. I've done a couple of Zoom gatherings now. Yesterday we did a Zoom birthday celebration for somebody. Maybe we can do some, we can begin doing some Zoom dancing. And I know that's going on. I say it as if it isn't going on. I've been hearing about these DJs, national level DJs that have hundreds of thousands of people following them for hours at a time, which is such a cool testament to our ability to overcome social distancing and still socially connect, which is awesome. And then last, it's really, really important. If you don't already have a plan in your head of what you do if something happens with regards to health, please start thinking about that plan and try to execute. So call your doctor, call your doctor's office and get figured out. You might have to wait. They may say, why are you calling? You're calling because you want to figure out what's the best way to manage an urgency and what's the best way to manage an emergency, knowing that going to an emergency room in some communities right now is probably not recommended. So make those calls, and it may be that you can communicate by text, you can communicate by email, you can communicate by other means than showing up at the doctor's office and get business taken care of. There's now capacity to do telehealth, and if you're on this call, you can do telehealth. Telehealth may be a way to follow up with your doctor in some communities right now that keep you from having to be in a place where other sick people are, some of whom may have COVID-19 and not even know it. So I'll stop there and hope that we have another chance to do this another day, because there's just so much information to share.
But there really is. And Pastor Sonjia, I'd like to transition to Pastor Sonjia, because Pastor Sonjia, right now, there are a lot of myths in the marketplace. And I think a lot of what Dr. Sanchez talked about really dispels a lot of those myths. However, you are the expert here in this area, so I would love for you to speak to some of those myths, and I'll allow you and Dr. Sanchez to have that dialogue. Pastor Sonjia?
Absolutely. I really enjoyed the information that Dr. Sanchez shared, and we are grateful to be mythbusters, if you will, this morning. And so one of the myths is that we are defined by our attendance, that somehow our attendance at services is a lack of faith. But we are not defined by attendance, but instead we are defined by our relationship with God. And so the relationship certainly makes me want to go, but it does not make me want to put anyone in danger. Dr. Sanchez was so on the money when he said we must assume that everyone has it. That should be our approach to interactions. So the social, physical distancing, as I like to put it, is very, 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 it is important that we follow the scripture, and I wrote it. I've got a lot of notes over here too, Dr. Sanchez, but it's in Matthew 19 and 19. Honor thy father and thy mother, love thy neighbor as thyself. And so when I am not getting together in a large group, I am actually showing love for those who are there. I'm making sure that I am not a part of kind of an incubator that just allows this COVID to run rampant through those who are gathered. And I dropped out for a moment there, so I'm not sure if Dr. Sanchez has shared the story that he shared with us the other night. Have you spoken of the 75-year-old that you're familiar with, Dr. Sanchez?
No, let me tell that story real quick, because I think it's relevant. First, my patient, back when I was seeing patients, 75-year-old, we'll just call her Mrs. Jones. Miss Jones came to see me one day, and she says, you know, Dr. Sanchez, let me tell you a story about something that happened to me. A couple of days ago, I was at the supermarket, and while I was at the checkout stand, a young man grabbed my purse and ran out the store. That was my purse. So I started running right out after him. The security guard was ahead of me going after him. And you know what? After a little while, that security guard, he was a little large, she says to me. I had to stop and bend over and catch his breath. Well, I ran and I ran and I ran. I chased that young man down. I got my purse. I came back. And you know what, Dr. Sanchez? That man, the security guard, he was still bent over, having not caught his breath. We have an obesity problem in this country, Dr. Sanchez, she says to me. So that same lady, and it was joy when she came to see me. She was just a wonderful lady. So she comes to see me one day. She says, you know, Dr. Sanchez, I just got discharged from the hospital 3 days ago. And what had happened was that she went to her church in Austin, Texas in July. Temperature was 100 and something degrees. The air conditioner didn't work in the church. She goes in the church. She had a few health issues, and he got to her and she fell out. So she gets taken to the hospital, and she's there for a few days, and she comes back to see me. And as I said, she tells me this story. And I said, you know, Miss Jones, I'm pretty sure God would give you a pass the next time the air conditioner is out. You could, and I bet your pastor would give you a pass if on a Sunday the air conditioner is out and it's 100 degrees outside. Take care of yourself because that's what God wants you to do, to take care of yourself. And so I shared that story because I think that the message has relevance because COVID-19 is about taking care of yourself and protecting others in the congregation from yourself. And I'll just stop there. That was the story I told.
So I have a story since you shared that story with me, Dr. Sanchez. I don't know if everyone will be able to see it.
Pastor Sonjia, we're having a really hard time hearing you.
And then I have another one to show you. Are you? Okay. All right. Let me see if.
Pastor Sonjia, it's saying that your internet connection may be low.
Now.
Keep talking.
Okay. All right. How about now? How about now?
That's better.
How about now?
Yes.
Is that better?
Yes.
Yes.
Another. So we had 7. Oh.
Pastor Sonjia, you, what we will do, Pastor Sonjia, maybe you want to call in on the number instead of using video, and just, why don't you call in, and then we will ask a question while you are doing that. You know what, quick question, Dr. Sanchez, while Pastor Sonjia is calling in, because there's a lot of questions. Actually, let me just make a statement really quickly. What we can do is put together a frequently asked questions document, and we can send it out to everyone that is on this call, because there's about 15 or 20 questions. And then some of them, because I think we're going to continue to get asked, we will probably create some videos for you to be able to share among your family, friends, and your congregations. So let us work through that, and we'll be able to share that out. So one of the questions that came up, Dr. Sanchez, is are there any types of vitamins that can help to boost our immune system?
I'm going to try not to be snarky. No, there really are not. If you eat a healthy diet, there is nothing that you aren't going to get from the healthy diet that you eat. And what we recommend at the American Heart Association is a diet that emphasizes fruits, vegetables, legumes, lean proteins, complex carbohydrates, that is whole wheats, as opposed to refined carbohydrates. That would be white bread is in that category, and limit the amount of processed meat that you're eating, particularly processed red meat, and limit the amount of sugar, particularly sugar-sweetened beverages. If you do those things and you are eating a good mix of fruits and vegetables, you are getting all the vitamins that you would otherwise pay money to get and buy at a pharmacy. Do that. Take your medications that have been prescribed. Get outside. The one thing that I would say is try to get some sun every day. The sun is therapeutic on so many levels. One, it helps with vitamin D metabolism. So rather than take a pill, take some sun. And being outside just has a way of making us feel a little better. So if you can dance or move or breathe outside, that's better. And, you know, seeing trees and seeing nature and seeing life going on that's outside of ourselves is a good thing. I happen to live really close to a hike and bike trail, And the thing I've come to realize is that there's some animal life out there that is really happy that there isn't so much human life out there. And just get outside and enjoy that. Vitamins, don't spend the money on vitamins that because you think they're going to protect you. Eat healthy, be physically active. There's one thing I want to make sure we do, because I don't want to run out of time, because part of what we wanted to do was make sure that we talked about Empowered and Well Healthier Church and the Well Healthier Church Challenge. So Pamela, if I can talk a little bit about that, since Pastor Sonjia was going to do that, and if you don't mind, unless you want to do it.
No, you know what? Pastor Sonjia is back. Pastor Sonjia.
Sonjia is back.
Yes.
Awesome.
She is back.
All right.
I'm back. Okay. I'd love to talk about that because it's been a big deal. Oh gosh, it's been a big deal in my life. So let me tell you about it. That empowered and healthy church challenge has really changed the lives of over 100 women that are connected to us, that have taken the challenge with us. And I was telling you about the 7 gentlemen that I showed you there who had passed within the last week. And then on yesterday, my uncle passed. Now, all of these were great men of God. The 7 I didn't know personally. Obviously, I knew my uncle well, but I did know them, just like I knew that 75-year-old woman. They were giving people. I read the comments about them, the tributes. They were pastors and shepherds and mentors and fathers, and they were great people. And it is important. And the 7 reportedly had all been at one event together. It's so important that we implement social physical distancing, that we worship. You know, I'm actually sitting in my living room that's been converted. And this is where my husband and I give our sermons to our congregation. And we stream. It's so important that we implement those things in this season. Now, the Empowered and Healthy Church Challenge has really empowered me. AHA has come alongside us as we serve our community. And especially in this time, I know that God knew that this time was coming and we needed them more than ever. The things that they have taught us, the healthy practices that we now implement as a result of the sessions and the classes are priceless. We look forward to it. We actually, it was originally supposed to be a 12-week program. We've decided it was never going to stop. If we had to kidnap Francesca, whatever we had to do in order to keep her there, that's what we wanted to do. And so I just encourage everyone to be really involved in that. And I know that, Pamela, we have some exciting news. Originally, it was for a smaller market, but we're so grateful it's going to be expanding. And so, Pamela, why don't you share with us how that's going to work? I'm so excited. A lot of my family is on the line, and so I want everyone that isn't already a part to make sure that they join.
Oh, most definitely. And we are very excited. And, you know, I want to express my gratitude for working for an amazing organization that recognizes that the faith community is a true pillar in the community and delivers and connects with those individuals and the faith community being very trusted. And so I am very grateful for that. And as a result, our leader, Nancy Brown, who is our CEO, she came to us as a team and said, can we expand Empowered and Well to all faith communities across the country? And we were like, we sure can. Let us get on it immediately. And so we have been working over the last couple of weeks to create the right infrastructure to be able to distribute the information and package it accordingly to be utilized by the faith community. And so starting, and I will let Francesca talk about all of the specifics, but the Empowered and Well curriculum, the lessons, etc., will be available to anyone that would like to utilize the materials. The nice thing is that we are offering it in a lot of different formats, meaning that we have pre-recorded information. So Dr. Sanchez talked a lot about diabetes and blood pressure and being physically active. And so there is actually a module on each of those risk factors for cardiovascular disease. There's one on stroke. So yes, and so we have taken a lot of time to put the information in a format that can be delivered, even if you're not a healthcare professional. So the information is pre-recorded, and we're also going to offer this format of being able to be interactive. I think today really proved out what many of you suggested to us, and that is to have live lessons. And so this will be opened up to anyone that would like to participate, any of your members. So we will be able to do those lessons live as well. So I'm going to pause because Francesca and Katie and team have been working very diligently on the details behind this. And so Francesca, would you like to speak to how the individuals that are on this call, how they can get access to those materials?
Definitely. Thank you, Pamela. And thank you everyone for joining us. Yes, as Pamela mentioned, we want all faith communities, especially during this time, to have access to the American Heart Association health lessons and resources. So all you have to do is really simple, is email us at empoweredtoserve@heart.org and let us know that you are interested and that your church is interested in taking part in these health lessons. And as Pamela said, we are going to have live weekly webinars through Zoom where you can join in and receive the information. We also have pre-recorded videos that you can watch at another time, maybe after the kids have gone to bed or early in the morning during a devotional time. And then also there will be an audio version. So we want to make sure that we are meeting all communities where they are and you are getting the health information. Again, we can all know that we are in a community together, and that's why we wanted to create this virtual faith community, because as Pastor Sonjia mentioned, you know, we are all going through this together, and so let's all go through it together. Right? Let's all make take the opportunity to know that we are joining with others in their faith across the country. So again, they are going to be 30 minutes, so they're quick. So you can have your morning coffee and have your notes ready. And they're going to be live Zoom webinars as well as pre-recorded. So again, just email us at empoweredtoserve@heart.org and we will send you the information and the link to all of the lessons and the call-in information. I'm going to pass it back over to Pamela.
Thank you so much, Francesca. I would at this time, because I recognize that we are over time. However, I think that this has been such a robust conversation that I'm going to ask that we put together a frequently asked question. I'm sorry, it's still early for me. A frequently asked questions document that we can send out to all of those that are on this call today, and then also send it out to everyone that was invited to this meeting, because I think that because of all the questions that are in here, we can't get to all of them today. But I do think that we will ask Dr. Sanchez and Pastor Sonjia as we move forward with our online sessions that we carve out maybe 15 minutes at the top of those calls to discuss COVID-19. I think that would be really helpful for everyone just based upon the information that is being shared. So because we are running over, I am going to ask Eduardo and Pastor Sonjia to give us some parting words before we transition for today.
All right.
I'm going to let you close, Sonjia. You were great. You were a great opener. You're going to be the great closer. You know, a couple of things. One, do all those things that you can control. Larry Cannon, our chief financial officer, I know he's got another title, but that's okay. Larry Cannon says, control the controllables. And I just think that that's a perfect way to describe how we ought to be living our lives every single day. Control the things that you can control. And that includes hand washing, and that includes the keeping surfaces clean, and that includes acting as if you have it, COVID-19, and acting as if everyone else has it, and then doing all the things that you can control to keep yourself from getting it. That's one. Two, we didn't get to it, but soap and water for 20 seconds or more is better than hand sanitizer, but hand sanitizer is better than nothing. So soap and water. And I'm keeping soap and water and hand paper towels in my car, and I just wash my hands instead of using the hand sanitizer when I can. Last thing I'm going to connect you to, I would urge anybody, I saw a question about Spanish language, and we'll ponder that, but I would encourage you to go to the National Alliance for Hispanic Health website. They've got some really, really well done material on 20 things that you can do to protect yourself from COVID-19 in English and in Spanish, done in a way that a fifth grader can understand it. And I think whether it's to your congregations or with other ways, there are some messaging opportunities there to keep us all doing the things that we can do to control the controllables. So with that, Master Sonjia, on to you.
Well, I just want to encourage everyone, as I said earlier, to feel better. Make sure that you're praying, make sure that you are dancing, make sure that you are refocusing. It is so important in this season to see the beautiful things that are in this season. You know, the Church of God in Christ is the largest Pentecostal denomination in the world. And I was doing some research last night, and in 1918, they postponed their convocation, Bishop Charles Harrison Mason, due to I believe it was the swine flu pandemic then. And there is a precedent that has been set in our community for making sure that we take care of our congregants when there is a time that is harmful to them. And so I want you to listen to the science. And I want to point out that Easter is coming, and that's a big day. It's a big day for churches. It's a big day. And I want you to know that our churches will be empty on that day. It doesn't look like we're going to be able to gather that day. But I also want to remind you that there's a tomb that's empty. And it's where our Savior was, and he rose again. And so we're in good company, because we have the opportunity to give hope and to provide hope in a whole new way. This is our finest hour, and it's our finest hour in a different way than it has been before. So our creative God will speak creatively to you and show you how to minister even in this season. And we can come alongside of organizations like the American Heart Association. We can implement the items that are at cdc.gov, and we can set an example of how to go through a difficult season. So I'm really excited about how God is going to use us in this time. And Dr. Sanchez said it earlier, and I want to reiterate that our hearts go out to those who have been impacted by this, by those who have lost loved ones. We can't afford to keep losing those 8 amazing men that I showed you. Within the last 2 days, we've had about 15 pass away that were somehow connected to us, or we knew them. We have to do what we can do in order to stem this and to flatten the curve. I love that quote. We must control the controllables, and there's a lot in our power to control. So we just thank you for listening, and we thank you, AHA, for this time that we've had. This has been so informative and so great. I'm going to give it back to Pamela.
Amen, Pastor Sonjia.
Yes. Amen, for sure. And thank you, Pastor Sonjia. You have been an amazing ambassador for the American Heart Association and for the Empowered and Well Healthier Church Challenge, as well as now the broader Empowered and Well Faith and Health, because it's so important at this time that we work together, that we share credible information. I think we are all receiving all bits of information that are not coming from credible sources, but we do have resources, and so we want to be able to do what we can as an organization to share that information to you accordingly. Like Dr. Sanchez, I would like to actually close with a quote, if you all don't mind. I am a huge lover of Maya Angelou, and so I will close with this quote today. My mission in life is not merely to survive, but to thrive, and to do so with some passion, some compassion, some humor, and some style. Have a blessed Saturday and weekend, and enjoy your time with your family and friends. And don't forget to check on someone this weekend. Have a blessed day.